But what I'm getting is, this puts the tension in on the downside upper cervical, COC1, C2. And by doing that, it's gapping it open this way. But it's so tiny that, that's why I said elusive. So this is like that springing, what we did, but it's springing through a little microscope. So you're seeing 2 grains of rice copulating. You know, you have to look at it at a microscope just to see what's right. Because if you can imagine the grains of rice have genitalia, it would be pretty tiny. And that's the way to think about this. So here's her endpoint for rotation. It just stops. I'll make sure that I keep her in the vertical. I'm pulling my bottom hand, hooking under the occiput to me. I'm going here. So I put a little pressure to take the remaining slack out. And then I spring. I'm going to take my hand up a little bit on the bottom, there. And I'm looking for springing. That's how much it is. I mean, it looks like nothing from the outside, but it's an entire planet on the inside. The entire population is wondering where this seismic activity is coming from.
So for this move, it's actually passive. It's a passive.
It's a passive move. It's a passive move. The nature of all joints, almost without exception, bony joints, is that they should spring. That's the sign of a healthy joint. Doesn't mean that it's not healthy, it means it doesn't spring. And the beauty of this is when you test this and you spring and it's not there, the answer is to spring it. And give it a minute or two. There may be other things that you need to do first.
So when you say spring it means just keep rocking it until it has some...
And there's a difference, so I'm going to show you. Here's rocking. And here's springing.
So you're pushing and releasing as
I'm pushing and releasing. But it's tiny. I mean, it's really tiny. And now we'll check the... That's even a little more better. Yeah. Let's go check and see what this side is. Now this side, here's another cue. Just in passively turning the head, watch what her chin does on this side. And now watch what her chin does on that side. She starts to poke her chin out just infinitesimally more.
It feels like a lot more. It almost feels like you're moving my head in a different direction.
No, I'm just letting your head roll. I'll try it again. I'll try to be as...
And the heads were rolling.
And there it was, see? Right at the very end. So it's tiny stuff. But because there's tiny bits, it's important. It's a relative value system. If she had joints as big as a swinging door, then that would be inconsequential. Same thing. And I'm getting that also on this side, there's not a lot available in terms of springiness. So the answer is to go in there for a minute or so.
Now why wouldn't you just take it to the end?
I am.
Well, but hold it, then hold it.
Oh,
until the body then can just release. As opposed to this back and forth thing.
It's a good question. There's a difference in this case between the hold and wait for release between a contractile tissue and a joint.
Okay.
So what's happening here is my supposition is I'm taking the joint to the end play. I don't know if it's capsular, ligamentous, or muscular. If it was muscular, I think I would still get a little springiness to the answer. So I'm thinking, in my mind, that it's possible that the upper cervical joints in Judy's spine are a year or two older than she is. And then I need to know about history and things like that. That would give me some more evidence to see.
Are you just saying that because of the springiness? Or?
Because of the lack of the springiness and the quality of the endpoint. So it's not there, but it's also harder, which is more bony.
And this treatment would it then
it doesn't change structure.
or
or,
Doesn't, no,
okay.
you
so
can't
can't-
unboil a hard-boiled egg, but you can manage from getting it worse. You know, because the condition of bony exuberance that's inappropriate, if you will, if you want to describe it that way, happens because it's opportunistic. At a certain point, it's like a runaway freight train. You just can't stop it. But there are points along the way that you can manage it better and keep it from spiraling so quickly so that, you know, by the time you're 120, you're allowed to complain a little more. So let's go here. Endpoint. Distraction from the bottom hand. Reinforcement, opposite direction from the top hand. Don't press on the TM. And gentle springing, if you can. Now, sometimes you might want to back off just a tad and see if it does spring, and it does.
Back off with a distraction.
Back off with the rotation. So I'm
With the
backing
rotation.
off from the end point a
Mhm.
fraction,
I see.
just a fraction,
Yeah.
because I want to make it happen,
Mhm.
and I'm willing to come in second as long as I finish. Normally you would do that for as much as a minute. It's a long time to do that when you're doing something that small and unchanging.
So do you find like if you backed off from the end point and then if you release that, if you were working on somebody, would you just go a little bit farther and try that again?
Yeah,
Okay.
yeah. And if it's not there, then I go, it's not there.
Okay.
Okay, but now let's check this again. So let this relax. Yeah, now I see a noticeable small change. Small enough to come on my radar. I don't know how it comes on your radar. But I see that there's an improvement in this.
Mm-hmm.
That means she's able to say yes more frequently than be neutral. So let's try these two moves.